True or false? Dementia is a normal part of aging.
That's false. So dementia means slowly progressive changes in memory and thinking and function. And while there can be some mild changes in memory with aging that it can be normal, like processing speed and organizing things, the term dementia, where it's going on for years and affecting their day-to-day life, is definitely not normal.
Number 2, Alzheimer's versus dementia. Are they the same?
They are related but not the same.
What's one early symptom of Alzheimer's most people miss? Hey everyone, welcome to this another episode on our podcast Hormones and Hope. And today we're going to talk about the most important organ of our body, which is irreplaceable, and that's the brain. I have Dr. Dani Cabral. She is an Ivy League trained, internationally respected Alzheimer's specialist, neurologist, as well as a psychiatrist with over 15 years of experience in Alzheimer's care as well as clinical research. She is definitely known for her unique ability to translate cutting edge science to real world, deeply human care. What I was excited about was Dr. Cabral has served as a principal investigator for multiple Alzheimer's clinical trials. She's received grants to advance access and awareness and also speaks widely on transforming brain aging and care. Now, Dr. Cabral is practicing in Phoenix, and she's founded her practice called Brain Love. Love the name, Dr. Cabral. And we would love to know more about, what is the mission of this medical practice, and how are you translating your research work now into clinical care? So welcome to our episode, and I'm very, very thrilled and excited to learn a lot from you about our very important organ, brain.
Thank you, Dr. Makhija, for the kind introduction. You are an inspiration with your own practice, so I really appreciate the opportunity. And now you call the brain the most important organ, even though, that's not your maybe technical area of expertise. So they're all interconnected. So the mission of Brain Love is to revolutionize the model of care for brain aging for people who have progressive memory loss with aging, Alzheimer's, and similar diseases, to not focus solely on the decline, what's wrong, everything's going downhill, but to focus on the possibility for growth and transformation while addressing these real challenges, medical, physical, for the person, and also often for the care partner and family.
That's beautiful. There must be something igniting within you, the fire that led you decide that, okay, that research work or practiced for so long that now I need to create this space, this environment, which is more holistic or wholesome.
Yeah, I kept hearing the same criticisms and complaints and gaps in care over and over again. Even though we've had these advances in Alzheimer's, ability to diagnose early, there's new treatments that target the biology of disease. Truly, very few people actually know about this, believe it actually helps. And there's still really a focus, even by our healthcare professionals, that there's nothing you can do. And then I would, frequently hear families say, like, I wish I had known this. Or the patient, I wish I had known. And it's like, why can't we change the system or create new systems so people can learn and know? And yes, everyone is truly unique, and their journey will be unique to them and their family, but there are predictable things that happen with these diseases, and we can equip patients and families with the knowledge and the mindset that they can take control of their lives and work together to live fulfilling and rewarding lives. So I just saw the opportunity, like, let's try something very different. And I needed to step outside of the traditional healthcare system and have the freedom and flexibility to try things, take feedback, and then be able to be agile and adapt to like what people really need and want.
That's impressive. And what I learned from you was that this is not patient-oriented care, but you're also including the caregivers as well as the family when you're treating or when you're providing care to your patients.
Yeah. So for the Brain Love practice, it's a membership model. So we have the options of the patient membership, there's the care partner membership, or there's both the patient and the care partner. So say you have an older man, with early stages of Alzheimer's disease, and his wife would be the care partner. So they could either individually enroll or they could enroll together. And the care partner membership is unique. And I don't really know of this existing in this way anywhere else. So what we're trying is that we'll focus on their mental health and well-being in a holistic, comprehensive way. And as a certified psychiatrist, if they need to, I can prescribe some gentle antidepressants or things like that, sleep medications if needed. But truly, the emphasis is going to be on understanding, you know, what what do they need for themselves in their lives to engage in the self-care, to fill their cup, to not be overrun with guilt, to do those things for themselves, and to know and believe that the more their well-being is supported, actually, we hypothesize that the better their loved one with Alzheimer's will do also.
Yes, yeah, because you see that overwhelm and the rates of depression in the caregivers way higher. Yes. So, Dr. Cabral, let's start with our exciting topic. We have what we start with is called rapid fire and just simple, straightforward yes, no, or one liner answers. And if we feel like you would want to give us a thorough explanation for one of these or a few of these, we can get to it after our rapid fire. So, here we have. So, number one. True or false? Dementia is a normal part of aging.
That's false. So, dementia means slowly progressive changes in memory and thinking and function. And while there can be some mild changes in memory with aging that it can be normal, like processing speed and organizing things, the term dementia, where it's going on for years and affecting their day to day life, is definitely not normal.
Number two, Alzheimer's versus dementia. Are they the same?
They are related but not the same. So I mentioned what dementia is. So dementia just describes symptoms. So is there memory loss? Is there word finding difficulty? Is there trouble with certain day-to-day tasks? Whereas there are 100 causes of dementia. Alzheimer's disease is the most common cause, and that represents Alzheimer's disease as specific changes in the brain, so the amyloid plaques, the tau tangles, but there's other causes of dementia such as vascular disease, Lewy body disease, and many others.
Got it. Thank you. What's one early symptom of Alzheimer's most people miss?
So we often think of this short-term memory, repetitive questioning, rapid forgetting as Alzheimer's disease, but there can be many other things. There can be word-finding difficulty. I would say there can be changes in someone's used to do something really well, like they'd always pay the bills, they'd never miss it. They're always a great cook. They never messed it up, but something they started to make a mistake, and that was very uncharacteristic for them. They can't remember the recipe exactly, or they missed some bills or miscalculated. So those are the kinds of small things that you need to be aware of. They could be a sign that that is something bigger going on in the brain.
So it's more the daily mundane task that they're forgetting would be the earlier symptom.
Like the unique to that person. And so it's not technically always like forgetting. It could be that they can't organize and multitask the things smoothly and quickly, like with the bill paying, and keep track of the systems the way they once did.
The next one is can dementia risk be reduced even if it runs in the family?
Yeah, absolutely. So we now know that up to 40% of dementia can be prevented with modifiable risk factors. And so while having a family history might increase the probability, and we don't know that for sure, it's certainly not a definite thing. And so we know that age and genetics we can't change, but there are so many other lifestyle factors, especially cardiovascular health, making sure your blood pressure is right, making sure your cholesterol, not smoking. So there's a lot of things that absolutely can reduce your risk.
The next one is memory loss or stress. How do you tell the difference?
Yeah. So it can be hard to tell the difference at first. If we know someone has some major stressor in their life, that is going to lead to an inflammatory environment, as we know, and that leads to all sorts of chronic medical issues. And so, what we can do is, if the address the inciting event for the stress, support the person, and when that resolves, then the cognition should improve. But truly, in older adults, it is hard to tell the difference, and we can have both. So, early detection is important. Even, we don't want to just assume everything is stress.
Got it. So that brings me to the next rapid fire. Is there a blood test or a scan to know if you're at risk for Alzheimer's?
At this point, what is approved are advanced brain imaging techniques such as amyloid PET scan to look for the amyloid plaques in the brain, and those are things that start building up years before symptoms. There's also cerebrospinal fluid testing looking for that, and tau tangles. There's a blood test that has been approved recently by the FDA, but these are all, importantly, only for people who are symptomatic. These aren't approved for use in people who are at risk and cognitively unimpaired. And why is that? Well, many reasons. So we don't have medication treatments approved for individuals who are cognitively unimpaired. And then so some people might say, well, they can change their lifestyle. And absolutely, if they find out, they could change their lifestyle, but there are risks to potentially getting long-term care insurance. This is going to be a pre-existing condition. So I caution clinicians and patients to just actively go out and do that at this point, before they have any symptoms.
So, what's one thing, because you were talking about lifestyle and the test where they're already in the early stages. So, what's one thing that you would wish the younger age population, so 40-year-old brain, can do to prevent dementia or specifically Alzheimer's?
So the data is clear that in midlife, especially, consistent aerobic exercise can significantly reduce the risk of developing these symptoms of Alzheimer's disease 20 years later. So you're looking into the future and you're future proofing your brain. And so getting anything to get the blood flow, blood pumping to the brain, such as aerobic exercise, is absolutely the way to go. And of course, we always counsel start small if you haven't been into exercise, but work your way up and do that safely. And that absolutely is going to make a huge difference for everything, right? For your heart, for your mood, your sleep. So there's so many benefits besides that.
Okay, so that's been very much proven. So, aerobic exercise, is there a guideline to suggest? So, like for American Diabetes Association, American Heart Association, we usually have a guideline specific 150 minutes through the week, or break it down into 30 minutes in a span of 5 days out of the 7 days. So, is there something specific which has been studied?
It's not yet a hard recommendation, but this 150 minutes throughout the week is similarly recommended in the brain health world. However, I really personally think it's about what is the person going to stick with, and what is going to keep them feeling good to do that every day and not dread it. So I tend to be a little more like person by person, because consistency is actually the most important thing. So if you do 150 minutes a week for 6 months and then you stop and then you don't do it again, like, honestly, that's not going to do too much. But if you do 90 minutes a week and you do it for 5 years, like, that's going to make a huge difference.
Yep. So, yeah, I would agree with that, Dr. Cabral. I just, with my family, we are like five close cousins, and we just started this yesterday with consistency. Everyone is like, I need to lose weight. Someone has pre-diabetes, someone has diabetes. And I said, okay, let's just start a challenge on WhatsApp. And it's all about going to be consistency. It's not about that I'll do this, and achieve a goal by December 31st, but how we can build that consistency, and we'll just support each other with that. So, so beautifully said.
And can I just add, like you're talking about too, creating community, social connection, like that's so much in addition to just the exercise. So
Yes, absolutely. Yeah. So because, you gave us like a definition for dementia and Alzheimer's, could you elaborate more or just walk us through like the risk factors? So other than having a family history, what are something modifiable, that means changeable, versus something that you cannot change, which I'm sure genetics is a big part of it, that people can actually know about and they can actually work on it intentionally?
great. So there was this big Lancet commission on dementia prevention that was published last year in 2024. And what that showed was that the things that we can work on, and particularly in midlife, include, and this is to reduce your risk, say 20 years later. So hypertension, high blood pressure, smoking, depression, physical inactivity, diabetes, excessive alcohol, obesity. Then there's things like air pollution, head injury, social isolation, high LDL cholesterol, and then untreated vision loss was also added onto there. So even like the hearing loss in midlife, certainly, we see that. Or maybe I see, we see it a little more in men too, and they're going to just like put it off. They're in their 50s, but actually you're decreasing your sensory stimulation of your brain and it's getting weaker and your world is getting smaller even in your 50s. And so all of these things and optimizing your vision, those are I think interesting things that we wouldn't have thought of.
Yeah, that's very neat about the hearing because you explained it well that you're limiting the stimulation to the brain with that. I had an uncle visiting. He's a young 70-year-old, and he's like, "No, getting a hearing aids is too expensive. I don't want my son's money." But it's such a hard time for all the family members to converse with him and repeat over and over again. And this would be a great one that I'll share with him. That stimulation is one of the, or not having that stimulation is a risk factor. So all these are modifiable that you just mentioned to us, or we can work on treating them. So other than genetics, is there anything else which is not modifiable, not in our control in terms of risk factors?
So there's age. So age is definitely a risk factor for these neurodegenerative diseases of the brain. And then your gender. So we know that women have a much higher risk, females do, of developing Alzheimer's disease during life. And at age 45, for women, there's a 1 in 5 chance of developing this during their life, later in life. And then for men, it's 1 out of 10. And so that's an interesting one. And I'm so happy that there's more interest and research going on about this. So we don't know all of the reasons, but certainly there's something to do with the estrogen loss or deficiency that happens after menopause can disrupt the pathways that are related to developing Alzheimer's biologic changes in the brain. And I can go in, to more detail on that if you want. But it really is, it's not fully understood and it's not necessarily been recommended yet to, go on like hormone replacement therapy. But really I encourage people to keep their ears open for that. And I would say also with women, I'm curious of your thoughts on this. Women tend to hold on and push that stress down and take all that caregiving burden on, and it leads to this pro-inflammatory environment, and that just wreaks havoc on the body in so many ways. So I think that's playing a role, and as women can find ways to release that more and more, and I think that's more supported and talked about in the generations younger than the baby boomers, I think that is going to help. We'll see that benefit women like in 10 and 20 and 30 years.
Yeah, yeah, that's well said. I just had a patient last week on Thursday, a retired nurse, and her husband passed away in December. And she came to me for diabetes. Google search, her A1C was greater than 15.5. So very, very high where the Quest lab couldn't detect it, right? Like the numbers. And she's a retired nurse, has diabetes for almost more than a decade. And the reason she says that, I came to you because when my primary care physician saw this number, he yelled at me as if I was a 5-year-old child. And I was just done with him. And I was like, I'll search my own diabetes doctor or endocrinologist. But where I was getting at this point was as I'm getting into her social life and how, now solo living, is that what her husband went through, and she was the caregiver, and just the trauma of how much she had to deal with, like in terms of the caregiving aspect of it, led her to feel that isolation. And I wouldn't call it as a depression, but just not feeling like I should be mingling or considering social support, or I should be taking care of myself anymore. She also mentioned that I would love to join the annual membership because I know my diabetes is, completely out of control, but I don't know if I'll live for that long. You're touching really great points here. And, what I really loved when you started the conversation was how that caregiver is equally important in care when you're dealing with the family dynamics for a patient, because that support is needed from both ends. Coming that from a physician, a neurologist, a specialist is just one of a kind.
Thank you. Yeah. Well, we want to, show this as a proof of concept that this is going to lead to much better outcomes and happier people, across the board.
So, if you can elaborate now on specifically about Alzheimer's, as to what are the characteristics that differ as compared to, say, vascular dementia or other causes for dementia, and why are we all concerned? Or why do we have that fear that about Alzheimer's? What's so specific about it?
In terms of these progressive neurocognitive diseases of aging that cause dementia, so Alzheimer's is the most common cause and is present in probably 80% of people who have this cluster of cognitive and functional changes. And so we know the most about that disease. We've studied it the most, we've trialed the most treatments. And so we've learned that what is happening in the brain, or at least this is what we know at this point, these changes in the brain called amyloid plaques it's a protein, not like the proteins we eat, but it's a change in the brain that happens that messes with the brain cells. And that starts happening 20 years before or more, before any symptoms of Alzheimer's disease. And so we've learned that from years of research of people who we've different studies around the world, longitudinal observation studies. So they're followed every year. They have brain scans. They probably have cerebrospinal fluid testing, memory tests, mood tests, and then they have found consistently that people who have this amyloid plaque, a group of them then develops the second landmark of Alzheimer's disease, which is tau neurofibrillary tangles, and those appear in the brain closer to when symptoms start. And we don't, somehow they start working together, amyloid and the tau. And then soon after, the symptoms begin. Now, someone who has both elevated amyloid and elevated tau in their brains, and we can now measure that before their symptoms in a research setting, there's a high chance they're going to go on to have the symptoms of Alzheimer's disease. Like, not everyone, but a high percentage of them. And so we're in a position now that we have this long, silent, asymptomatic period that we know of. And how can we find the right risk score where a patient comes into their primary care, they're 55, their thinking is fine, and they get screening tests, not just they get the amyloid test, the tau test, say it's positive. And these aren't really, the tau test isn't readily available yet, I must say. And then they have other factors that show that they're at increased risk, like maybe they have hypertension and diabetes and obesity. So then that person could get on, hopefully in the near future, a treatment that will prevent or significantly slow the onset of the symptoms in their life. Now, other diseases, neurodegenerative diseases like Lewy body disease, so that's in the Parkinson's family, we know we're learning more about that as we're learning more about Alzheimer's. And this really is mind-blowing, but we now know that many people who are older have multiple pathologies in their brain. So maybe 40% of people with Alzheimer's disease also have Lewy body changes in their brain. The point is just everyone is very complex, and that doesn't mean we should just throw our hands up and say, well, we don't know what to do. I want to point out to the vascular component, this is something that seems to be, typically it's a counterpart of the Alzheimer's, and they work together to hurt the brain and to increase the rate of progression. So if a person has the Alzheimer's biologic changes like the amyloid and the tau, and they have a lot of vascular disease in their body and in their brain, they tend to have a faster course with their dementia. Their symptoms progress faster. And then they may have sequelae of the vascular disease in the rest of their body also. So that's another reason why early addressing of the heart health can have such a difference later also for a person who then goes on to develop Alzheimer's. So it's an exciting time because now we do have these advances where we can, like we said, diagnose early, and there are treatments available for the early symptomatic stages of Alzheimer's. There's treatments that directly target the amyloid plaques and remove them effectively and slow the progression of cognitive and functional decline. And so these have been FDA approved for 1 to 2 years and are available to people, a certain group of people. And I have led the phase 3 trials at my site at my prior job for those 2 medications, lecanemab and donanemab. And as much as I am all about comprehensive, holistic, like to me, that means both like Western medicine and everything else that we can, find for an individual and a family. And so that was a long answer.
No, that's very well explained because that breaks it down into the different types. So, for our viewers and listeners who have no idea what Alzheimer's mean, is there a way you can just walk us through any of your patients? Like, what is the patient going through? Like, what are their symptoms? What is it affecting in terms of their abilities other than the memory? It builds that fear in someone who has a family history that I don't want to go through this.
There's so many possibilities because the brain controls, everything, certain aspects of thinking, how our body functions, how we move, our mood also to some degree. So every person is unique, but there is that characteristic short-term memory issue where a person, maybe repeats the same question or can't remember a conversation they just had. But other things to keep an eye out, we talked about word finding difficulty, trouble organizing and multitasking, and thinking quickly to the degree that you once did. So it's all personalized. It's like, how have you been over your life? Like, I'm someone who tends to get lost. So people, my friends and family, like if I'm getting lost at 75, like they're going to be like, that's just how she's always been, right? But it'll be other things for me. And I would add some interesting, relatively new findings are that for a subset of people, the very first symptoms are not with their thinking at all. It's with their mood. So the first symptom could be some kind of depression, some anxiety. Like someone might be like, I've never been an anxious person. And suddenly at, 62, like I'm worried. Like, what is that about? And irritability can happen. So now, of course, if you're listening and you're experiencing this suddenly, like don't jump to that it's Alzheimer's, but it's a reason to find out, because if it is, like you're in an opportunity that if you get, treated early and like that can change the trajectory of your life. And so that like leads into that early detection diagnosis, the benefit of that.
And are there any physical manifestations other than the memory for these individuals?
Yeah, usually for Alzheimer's, there aren't too many physical manifestations in the beginning. As it progresses, it can affect gait, but that's more into the moderate stage of the cognitive and functional changes. If you're seeing physical changes like neurologic changes like tremor, slowing of gait, just slowing of movement, slowing of speech, posture is a little more hunched over, that fits with that Parkinson's family, Lewy body family, where there can also be cognitive changes simultaneous to that. So that could be what that's an indicator of. And of course, there are like rare variants that do some other strange neurologic physical symptoms.
So when you have patients and say their children are, I'm sure that you're getting tons and tons of these questions that what can they do? And I know you walked us through like a 40-year-old, what can they do with their activity? But in terms of, say, if you were talking to all of us as healthcare professional, right? So Dr. Cabral, as a neurologist, psychiatrist, Alzheimer specialist, is talking to see an endocrinologist. And you're trying to advocate that let's use some preventive strategies now for metabolic health, for, say, the menopause health, or for midlife for both men and women. What would those be in terms of convincing or making a conviction for the patient that these will help rather than just do these, improve your blood pressure, improve your cholesterol, improve your diabetes, and you'll probably have a less chance versus something which is more solid, something which is more concrete in terms of preventive tools.
Yeah, it's a great question. Because my first inclination is like everything you're already recommending, Dr. Makija, is what,
I know. Yes. I'm just curious. That's why I asked you this question.
yeah. What I would say the first thing I think, especially as we're getting into, say, our late 40s and older, is the mindset to believe that your actions can make a difference for your life. And you're not just going to get swept up by the healthcare system and have no choice and have no agency and autonomy. You can have that, but you have to take steps to figure out what is your risk and how is your health. And you have to face the reality of like, maybe it's not great in certain areas and like, but that doesn't mean it can't be like improved upon. And I think the other thing that prevents maybe people from taking those steps and to feel like sometimes even hopeless or like why bother is that there is such a stigma about Alzheimer's and these diseases. There's such a fear that many of us don't even want to go there. Like when we're younger, and it's like you can't imagine that for yourself. But like many of us will develop Alzheimer's disease. So I've started to think about befriending your future older wise self, and that person, like even like envisioning them. You can do this with AI now. Like, what am I going to look like when I'm 80? And like, how do I want to feel? And who do I want to be for my family and my friends and the world? And that can drive these small to large lifestyle choices. And then I would say, so all these things we listed and you listed, like they're all great. And I would say, so mindset and then confronting that stigma, like deciding like that's not, you're not going to take that on for you and your life. And then finding a community like you do with your WhatsApp, like accountability partners, close friends, whatever, church group, like we're going to, you could call it like your brain aging. You come up with some fun name. Like you're going to hold each other accountable in the long run. And you're going to see quickly once you start doing these things, right? Like people feel so much better. Even just the decision that they're going to do that and then do it together, it feels so good.
Mm, that's beautiful. I have to. I don't want to add anything else here. That's lovely. So Dr. Cabral, this was very very insightful. From your experience, because you're seeing these patients go through these stages, probably from the early stages to even almost their end of life. What's been working in terms of once they have Alzheimer's? I read through these, having them use puzzles, game, or something which is more mentally stimulating. What do you advise family members if they have family member who is dealing with Alzheimer's residing at home? How can they engage while there is ongoing treatment or care at home?
Sure. So I would say it's important to have a really good routine for the patient and the care partner, the family member. That really helps physiologically, the circadian rhythms, to have that sleep schedule be their optimal schedule, the meal schedule. Some people do good with a cat nap in the afternoon. Some people, it messes up their nighttime sleep, so they can't have that. But really getting to know your person and the three areas that are talked about that are good for brain health with when you have these diseases already and you're into the maybe moderate or severe stage are cognitive stimulation, physical activity, and social connection. Now, these can be hard for the care partner to like force on some people like are like I just want to sit and watch TV, you know? So I'd say take some of the pressure off yourself that like you'll do the best you can and also give yourself permission to take that caregiver hat off and like care for yourself and actually experience those moments and take the help that your friends and family are offering and don't feel like you have to do it on your own because that's completely counterproductive. And we know that caregivers often they get sick and they often die before the person with dementia. So I often have couples that the person with, the patient, they look great. Like they have cognitive impairment, but they're like happy and and then the spouse is like so stressed and getting sick and getting on more medications and so it's a choice they have to make to find that balance, and it's very hard for sure, but it can be done.
Beautiful and very inspiring too. Yeah, thank you, Dr. Cabral. So say if if we had to learn more from you, how can globally, how can people reach you? Is there any access versus do they have to be in Phoenix to get care, to medical care?
Yeah, so the right now the practice is in Arizona, so you'd have to have an Arizona residence in some way, or you could come travel to Arizona for your visits. We do telehealth also and in person for those memberships, but we also want to be a trusted, credible source, and really create help people feel like they can get help in different ways. And so we have a YouTube channel called Brain Love Community. We have a podcast called Resilient Aging Unfiltered. So you can get that on Apple and Spotify podcasts. And then people can feel free to email me. It's, our website, firstly, is mybrainlove.com. That's all one word. And my email is Dr. Cabral, like Dr. Cabral at mybrainlove.com. Anybody can feel free to reach out to me with any questions. I would love to try to connect you to help and support to wherever you live.
Yeah, mybrainlove.com. It's easy to remember, very simple. Great. Well, thank you, Dr. Cabral. This was very, very insightful. And, I'm looking forward to a lot of other evidence based strategies and treatments for this condition. And also what can be done in terms of prevention early on, other than all the discussion that we had. Thank you so much. And we look forward to having another discussion with you.
Same, I'd love to have you on our podcast.
Okay, done. Thank you. Thank you so much.